Austin is so great in so many ways, and it's always on the forefront of the newest technology, and now it's on the forefront of medical technology. A new medical device that's helping eliminate prostate cancer and saving lives is right here in Austin. We're going to go to the urology team and have a chat with Dr. Chopp. In the 1980s, if you had prostate cancer, doctors say you only really had about a 20 to 25% chance of getting your biopsy completely accurate. Nowadays, with new technology, that's gone up to 80 and 85%. That new technology is here in Austin, Texas with the urology team. Let's go meet with Dr. Chopp and see how they're saving lives.
We now have a much better way of saying, Mr. Smith, your PSA is elevated. We have done an MRI of your prostate, and it shows that there's a suspicious area in your prostate that we think may have prostate cancer. We can use that MRI picture as a map and a target for me to biopsy. And we now have the means of targeting that specific area. Up until 2014, our chances of hitting your area of prostate cancer was slim, 20–25%. Now that we have this new technology, we can make sure that we get through those areas of suspicion, and now we hardly ever miss. Now we're up at 80 and 85%. The reason that that's so important is because if we can be assured that you just have one or two small areas of prostate cancer present, then we can treat that area. And so we no longer go after your prostate cancer with a bazooka, like we used to do. Now we can use a 22, and we can either freeze those areas, sometimes we can heat them, sometimes we can laser them. So it has changed the treatment philosophy in men with prostate cancer so that it's no longer a real scary situation for them. This GPS unit allows us to read the position of the probe in the prostate. So a patient is lying here on his side. This is right over his hip. This unit reads the chip that's here, very state-of-the-art technology, and it reads the chip and shows me which direction I'm going, allows me to make sure that I get through these areas of suspicion. And this has been the big advance forward. A year and a half ago, we didn't have something like this, and so most all of the prostate biopsies were blind biopsies, random biopsies, and that was the problem. So if we're turning the prostate into a loaf of bread, we can see the prostate is outlined like this. And this is the target that we get from doing the prostate MRI. This is the area of suspicion. So when we go to doing the biopsy, this is the outline of the prostate. This is the target, and that's the target that we're looking after. And this core that you see here is one of the biopsy cores that went through that target. A gentleman comes into me, he has a PSA elevation, or if he has a prostate nodule, and oftentimes these men have had prior biopsies without any results, or if there's a strong family history of prostate cancer, then at the urology team, these individuals will get their prostate MRI image done. If it's normal, we tell them to come back and see us in a year. We'll reevaluate them. If there are some targets that Dr. Salinas from ARA tells me about, then we can use that MRI picture as a target to go after with our smart fusion biopsy machine. I personally have done about 150 cases, and so I think I'm probably by virtue of my experience, am the local expert in Austin, Texas. And so we invite not only patients, but other doctors to come in and learn this technology.
You know, the urology team here in Austin has been around for nearly 60 years. They got doctors in all three of their locations. But your very finest, Dr. Chopp, he's right here in the Northwest location. So if you have any questions, you know where to call. You know where to call. That number right now on your screen, 512-231-1444. Lots of good things happening there with the urology team. That's just one of the many. UrologyTeam.com is their website. You could find them on Facebook at The Urology Team and on Twitter at Urology Team. So there you go. All ways you can access them, and they're off of Jollyville Road.